It is my absolute pleasure to introduce to you Dr. Rachel Kornfield. She's going to be talking to us today about her work on user-centered design of scalable automated messaging interventions for mental health self-management. Dr. Kornfield is an assistant professor in the Department of Preventive Medicine at Northwestern University's Feinberg School of Medicine and core faculty in the Center for Behavioral Intervention Technologies there, or CBITs. She received a PhD in health communication from the University of Wisconsin-Madison, where she worked with an interdisciplinary team of scientists in the Center for Health Enhancement Systems Studies, or CHES, to design and evaluate mobile apps for substance use disorders. Subsequently, she completed an NIMH-funded T32 postdoctoral fellowship at Northwestern University that extended her training in digital mental health research. Her current work combines user-centered design methods from human-computer interaction with rigorous evaluation methods that build evidence of the efficacy and effectiveness of health interventions and support their integration into care. So absolute pleasure. Thank you so much, Rachel. I'll let you take it away.
Some of my earliest work was looking at mass media, so televised campaigns related to obesity prevention and pharmaceuticals, but it really became apparent that the media landscape was rapidly changing, with social media giving people opportunities to like and comment and share and really engage with content in new ways, which really fascinated me. And more recently, I focused on kind of dedicated technologies for health information exchange, such as apps and texting programs. And so I've kind of in my own work transitioned from focusing on reception, so how people receive health-related messages, to really how they can interact and compose messages and how that affects message senders. So that is my current focus. And I'll talk a little bit about the context, which is unmet mental health needs, why I think user-centered design is so helpful, and then my work in my K, which is focused on depression and anxiety, and I've designed an intervention called Small Steps SMS, which is an automated messaging program that tries to deliver more personalized automated support by using machine learning, specifically reinforcement learning, some of the data coming out of that, and then some future directions I'm excited about. So as we all know, I think, there are major gaps in our healthcare system in the US around delivering mental health treatment to all of those who need it. So there's been a lot of enthusiasm for digital health tools, digital mental health tools, to provide a scalable way of giving accessible support to folks. And a lot of people who are uninterested in formal treatments are open to using technologies. There's also accumulating evidence that they can be effective from clinical trials. However, the real world uptake of these tools has been quite low, and attrition has been high. So what do we do about it? I really think this is where user-centered design comes in, and there's many ways of kind of representing the process, but really, how do we engage end users, the folks who are going to be designing the tools and also implementing them, in helping us understand from the outset the problems they're trying to solve, and really iteratively putting concepts and prototypes in front of them to get feedback, sometimes going back to the drawing board, but ultimately trying to align the tools we produce with their needs. This is a model that's trying to combine user-centered design with implementation. This is another focus of my work, and also of our work more broadly at CBITs. So ultimately, we need to think not just about the tool, but how it's going to fit into an implementation context, how usually someone is going to provide services that integrate that tool, whether that is a coach or care manager or a mental health care provider. So you can think about designing the tool itself, but also the service plans that would support use of the tool. Because there's a lot of research accumulating that these digital health tools often do best when they're supported by some level of human support historically, whether that person is a mental health professional or not. So that's kind of provides a sense of accountability, a sense of encouragement, et cetera. But there's different ways to think about, what that support looks like. It's really a key to engagement. But there are issues with kind of the gold standard professional support in that it is very resource intensive, oftentimes the most costly piece of implementing a digital health tool. So there's other kind of solutions and ideas that have been proposed and put on the table. Peer-to-peer support is much more scalable. However, there are issues of inconsistent support quality, and also just the fact that giving support to others can be burdensome if folks are not prepared to do that. And so an idea I'm really interested in is conversational support that is automated, but that can kind of potentially perhaps fill in the role of human support and keep folks engaged. But I'll also acknowledge a lot of challenges here, even though it's highly scalable, but just being able to deliver automated support that's sufficiently engaging and personalized has been quite a challenge. But it is the challenge that my work is currently focused on. So some background on automated messaging. This could be text messaging, but a lot of messaging apps work very similarly through notifications. So WhatsApp and things like that, I think, are somewhat interchangeable with text messaging. Although texting is pretty universal in the US, so that is what my current work focuses on, is short messaging service, SMS or text messaging. And really the reasons it fits particularly well, I think, with mental health support is you can kind of, behavior change happens over time. So this allows you to deliver small pieces of content over a long period of time that can scaffold an ongoing change process. I think this is the most important piece, taking advantage of a familiar, easy to use function of the mobile phone. So we're not asking someone to download something new, learn how to use it, and open it when they want to refresh content. We're using a tool, texting, that they already regularly engage with, oftentimes throughout the day. So it has a reach benefit that's quite large. And then there's this theory called computers as social actors theory from human-computer interaction, which really suggests that you don't need to do a lot in terms of presenting in a human-like way to get people to respond to a computer program in a social manner. So you can build kind of a rapport or a human-like engagement just through, a human-like conversational style, greetings, and things along these lines. So I think that even though it's a really simple technology, using text messaging to have a conversation with the user is very engaging and can even provide a sense of possibly companionship or social interaction of some sort. These programs are also relatively inexpensive to build as compared to apps, and highly scalable. So once you kind of have your protocols, your content in place, you can roll that out to hundreds, thousands, et cetera, of users fairly inexpensively. Text messages are pretty cheap to send. And I might have mentioned this before, but there's a substantial subset of folks, especially with depression, who really want fully self-guided treatment. So how can we give them what they want, something that's self-guided, but still really keep that human likeness that's a key to engagement? So some challenges of automated messaging, however, at least historically, a lot of the texting programs for mental health self-management have delivered the same content to everyone. But this can feel a bit impersonal and be poorly matched to an individual's needs. And then, my needs may differ from someone else's, but it's also important to recognize that my needs also change. And so within the individual, based on their mood and energy, their availability, needs might vary from moment to moment. So a system would ideally be responsive to changes both between and within individuals. So the overarching question here is, how can we design automated messaging tools that are engaging and also responsive to these individualized needs? And I really take a team science approach in this work. So we have a multidisciplinary team on the computer science side, helping with the reinforcement learning piece, Joseph Williams and other collaborators at University of Toronto. And then also we've been working with Mental Health America, which is a large nonprofit mental health advocacy organization. And I'll talk more about them in a moment, as well as my team and colleagues at Northwestern. So Mental Health America in recent years has gotten a lot of traffic to their websites around self-screening in particular. So they host a series of screening questionnaires for a wide range of mental health issues. The depression one is the most accessed. I think they have upwards of 5 million people a year who are taking these screeners, and they're generally pretty early in their help-seeking process. So they might be experiencing symptoms of a mental, or possibly experiencing symptoms. They want to understand more about it, but really importantly, they're not necessarily ready or interested in reaching out for more formal mental health treatment. So this is in some ways a pretty specific population whose needs have been less considered because they're kind of harder to reach in some ways, not having already accessed mental health treatment for the most part. So what we've done is engaged folks directly at the point that they are completing these self-screeners on Mental Health America's website. And we've tried to represent kind of a diverse cross-section of folks taking those screeners and really make participation in our research as low burden as possible. So if people are really only comfortable participating asynchronously in a text-based discussion forum that's completely anonymous, that's fine. So that's, we hosted a couple asynchronous discussion groups. This work focused on young adults, 18 to 25. It was all entirely remote. So these discussion groups posted prompts every few days, asking questions about, digital mental health tools, design ideas, self-management strategies, et cetera. And people could respond to those and then also interact with each other. So challenge, build on one another's ideas and contributions. And then for those who were interested, we also had synchronous design workshops with a subset of those participants. And we also really tried to understand the needs, the organizational needs and considerations of Mental Health America. So we've been meeting regularly this is Teresa Nguyen here on the left, and with her team to understand kind of their approach. Well, first of all, they have a deep understanding of the folks, their users of their website, but also how will they ultimately be able to support these tools once the research phase is over? So, who are their staff? How do they want to be involved? And also, what are their existing online resources and content guides so that we can integrate as best we can with what they've already done? So this just shows what people might see after they complete a depression self-screener, which is the PHQ-9, and a little ad asking them if they want to try out our text messaging tool. So just a couple of the things that we've learned from our design work, really reinforcing the text messaging approach. Folks appreciate that they don't have to download or open anything. So one said, I'm always on the texting app. I don't have to open something else. They also really wanted the tool to be presented as a scaffold for self-help, which is distinguished from more formal treatment. So any way that we could kind of reference this is something that you're doing for yourself or helping you build skills to help yourself, those sorts of framings, they were very receptive to. And then we also found that they really wanted diversity and variety to sustain their engagement. So we presented them with, I would say, a pretty broad set of potential strategies that we could support, from acceptance and commitment therapy, from CBT, and positive psychology. And really they said, sure, we'll try anything, we'll try it all, as long as we can as long as it's a low stakes sort of way to experiment with different strategies. There was a lot of interest in being able to trial them out. And that was viewed as something that could help people stay engaged over a longer period of time. So one described, I think a huge part of how this helps is that it offers new ideas and suggestions. And importantly, people didn't just want diversity as far as psychological strategies, but also in terms of the ways to interact with the system. So not just reading psychoeducation and then getting a suggestion, but they also kind of pushed us towards other types of engagement, like reflection questions that they could answer, or peer stories, and other kind of ways to engage with the system. And I'll show some examples in a second. And they really wanted to be actively involved, both making choices and providing feedback about the content that they received. So I think oftentimes we think of asking for user feedback as burdensome, which it can be, but at least for these users, as long as that would lead to a more personalized version of the system, they were pretty willing, or expressed a lot of willingness to give us that feedback. So this is what we came up with. This is the Small Steps SMS program. It's currently 8 weeks long. It delivers automated daily dialogues, supporting a variety of psychological strategies. It is available, or an early version of it is available for free through Mental Health America. And it involves both active personalization, choosing the strategies to focus on, choosing the topics of stories to read, et cetera, and then also passive personalization through reinforcement learning, which I'll talk about in a second. This is just kind of a model of how the system works. So we have variety of strategies as well as content types. So it supports a variety of different types of interactions. We also have a lot of kind of micro level randomizations within the dialogue. So whether the suggestions are directive or non-directive, whether they provide a gain or a loss frame, whether they include rationales, and then also when messages are sent out and how many. And ultimately, we're collecting data about how people are engaging with different dialogues. So, do they respond? Do they click through to view the links? And that allows us over time to figure out which of the content types and strategies to send in the future. So I'll walk through some of the interaction types that we have developed. There's three primary types of interactions. So prompt dialogues, story dialogues, and writing. So prompt dialogues, this is kind of where we started, but we did build it out a lot through our user-centered design process. And what we try to do here is provide some background information on a strategy, and then help the user to make a plan to actually put the strategy into action that day. So on the right, I think it's behavioral activation, or an early prototype of a dialogue for supporting that. And these really unfold over the entire day. So there's some, background information in the morning and a suggestion, but we also, provide a reminder and a motivational message in the afternoon. And then we check in on progress later in the afternoon or in the evening. And what people really responded to is that oftentimes, they're busy and they forget. So they like that kind of gentle reminder or nudge to implement the strategy. So one user said it's really nice to get that kind of reminder throughout the day. When they get that reminder, that's when they can kind of take a step back and actually try out whatever the prompt is talking about. This is just an example script. So this is an interactive text messaging program, but I will acknowledge that the interactions are quite simple. So this is a rule-based approach, based on people's responses will take them down a different path. But at present, we do not have any kind of sophisticated natural language processing or, LLMs behind the messaging program. So it's kind of a simple tree-based structure for the logic behind it, but it's worked fairly well. And this is just another way of representing that. So, based on what the user says, were you able to do a pleasant activity today? They'll either get acknowledgement of that or encouragement to try in the future. In some instances, people really do want to write more about their lives, the specific challenges they're facing, their deeper reflections. So we do ask them to provide free text, although, we usually just to say, thank you for sharing or something along those lines, which is something that I'm trying to brainstorm kind of future potential directions to get a little more personalized in those responses. But that's how it works at present. This is the stories dialogue type, really based on what came out of these discussion groups. People really responded positively to seeing each other's examples of how they had addressed these common issues that come up in depression and anxiety. One participant described, I like hearing other people's stories and what they did, and it kind of helps me feel a little better, and I kind of bounce off it and do what they did and try these new things that they're doing. So both a sense of normalization and also potentially inspiration. So what we've tried to do with the stories dialogues is address very common challenges like feeling overwhelmed or feeling like I always have to be the one to reach out to people, unmotivated, et cetera, and show not someone solving the problem in a simple step, because that's not realistic. And a lot of people found that really inappropriate, but also showing that people can take a small step in the right direction and that can be helpful. So we're trying to kind of find that sweet spot, not minimize the work involved in change, but do show progress. And there is personalization in letting people pick or swap out story topics and then reflection questions that allow them to connect it back to their life and things going on for them. So writing dialogues, this is another kind of representation of the diversity of interaction types that people really wanted. And here we're really kind of building on this helper therapy principle and the idea that helping other people can also be helpful to oneself. So we asked people, what would you say to someone who's struggling with depression? How could you, help them feel a little bit better or motivated? And if they choose to write a message, we say, can we share this with other people in the program? We also ask, would you like us to send this message back to you next time you're having a hard day? And generally people say yes to both, but this is completely optional interaction. And this one user kind of encapsulates why this is, I think, helpful. I like the idea of this because often for me personally, I find it easier to help like a friend in need who's going through similar things. It's like easier for me to encourage them rather than encourage myself. So they're able to express something that might be helpful for others and then potentially see that reflected back as something that could be applicable to themselves as well. And then the modular approach is really trying to give people bite-sized interactions. And this is an opportunity when people have time and interest to engage that they can kind of keep going. So a lot of times people will have these brief windows of time. Maybe they're going through something and they want help. Maybe they're just bored and sitting there on their phones. But we'll just kind of say, do you want something else? And they can keep going for a while there. And really, it allows for more rapid experimentation with a diverse set of content types. And this is also kind of one of the main places where we've implemented reinforcement learning. So I'll show you how that works. So basically, there's a range of different aspects of content that we are using reinforcement learning to deliver. So just as an example, you can imagine this short prompt. See if you can give yourself some of the same kindness you would give a friend. Try to find a small way to be compassionate toward yourself today. So the strategy here is self-compassion, but we can either give an additional message that provides a rationale or not. We can also think about and then at the end of the interaction, we'll get some feedback. how helpful were these messages, and they give a rating 1 to 5. And basically how this reinforcement learning works is that over time, the rates at which these different arms are assigned, the arms being rationale or no rationale, will adjust based on the content ratings. And we use a multi-arm banded approach. It also takes context into account. So things like the number of days on study, their most recent mood rating, and things along those lines, so that which could potentially shape the benefit of a rationale. And so over time, you can see that the frequency that rationale is delivered might change. This is just hypothetical to 90% and no rationale to 10%. But there's a range of properties that we can test and that we're actively testing. So you can think about whether you give a link, the interaction style itself, story, reflection, question, peer message, short prompt. We're also experimenting with the time of day. That is a individual user level model rather than a group level model, because I think time of day is highly personal, what people's schedules look like. We're also looking at psychological strategy and a whole range of different properties. This is just another way of representing our adaptive experimental approach. Here, the contextual variables are mood and energy, which change over time, which is incorporated into the model. So just a little bit about how we've started to evaluate the intervention. Before we fully automated it, we ran a series of Wizard of Oz tests of the program, where we actually had a whole team of research staff who were playing the part of the system based on those detailed scripts that I showed earlier, which really meant kind of pretty much around the clock monitoring of people's responses so that they could follow the scripts and send out the right responses. So it was really quite a lot of work, but it helped us to figure out the bugs and really refine our scripts before we worked with a software developer to automate them. We also deployed an early version of the program through Mental Health America to about 5,000 users, which provided data to, improve the quality of the program, and then also, inform these reinforcement learning algorithms. And then recently we ran a field trial with 20 individuals to kind of inform both the design of the program and also the study protocol before we run an RCT. So I'll just give you some of the takeaways from the field trial that we just ran with 20 participants. So what was encouraging is that we had quite high levels of engagement, and that we saw even through the 8th week of the program, most people were engaging. So 85% still engaging in the 8th week, meaning they were responding to the text messages. We did see a significant pre to post test reduction in depression. We saw a trend in that direction for anxiety, but it was not significant. And then we saw pretty high usability scores. So the system usability scale is a pretty standard way of evaluating usability. 77, I would say, is pretty good. And then we also used the use measure. I think that stands for usability, satisfaction, and ease of use, which allowed us to get a little bit more granular about what particularly was usable or not. And so we had highest ratings for ease of learning and ease of use, I think reflecting that people are pretty deeply immersed in text messaging and really understand it. So those ratings were a little higher than satisfaction and usefulness. So something we can work on in the future there. And then some of the qualitative feedback for me was really most interesting here. So what we found is that even though people engaged, throughout the study, they were getting habituated to it, and it was becoming to feel a bit predictable, even despite the diversity and variety in content. And so sometimes they really wanted more personalized, responsive support, particularly when they're writing these free text messages and they just get a response that's like, thank you for sharing that. So there's a couple different possible directions here. One of them is a human coach. And then another area that I'm very interested in is large language models. So how could those potentially be integrated? And I'll talk more about that in a moment. we habitually get feedback that there's too many messages and that they're too long. So we have been iteratively just cutting. You really need to keep messages as brief as possible, we found, and send as few as possible. So really trying to find what is the essential content to send out, and being kind of brutal in the editing. And that's just been kind of ongoing. And then this is also kind of difficult. I'm very open to feedback and thoughts about this, but these highly idiosyncratic scheduling issues, and it's not just that my schedule is very different than someone else's, but my schedule is unpredictable and it changes. So how do we get that really detailed information about someone's schedule to know this is a period of time when we might be able to message them? And I do think there are opportunities with mobile sensing, potentially integrating with people's calendars. There's privacy issues with these approaches, but I do think it's worth considering, because if you're hitting people with messages and they are in an exam or things along those lines, it can really harm the relationship with the system, and something to look out for. And then this is another kind of bigger problem that I don't think there's a simple solution here, but what we found is that a lot of folks responded positively to the program. They liked it. They found it helpful, but they just got overwhelmed with their day-to-day lives and with things that came up, like moving or changing jobs, or financial struggles. And so when it's not a matter of simply adjusting the content or the algorithms, but this fundamental issue of busyness and overwhelm, and really deprioritizing any kind of proactive self-care of their mental health condition. So some of the next steps for the program that I see here, we're really still in the process of trying to understand how this reinforcement learning approach helps and how we can improve upon it. So we've collected this data from the public deployment, and we're really starting to refine the algorithm. So what are the rewards that make sense, meaning the proximal outcomes, like whether people engage or their ratings, what's the best way of thinking about that, as well as what are the most relevant contextual variables, and then are there different experiments that we should be running or different arms that we should be assigning. We just launched one RCT that will look at a version of the system that has these reinforcing learning algorithms relative to one that doesn't. Basically, those same decisions that would be made by the algorithms are being made randomly. And then there's a third condition, which is a psychoed control. So we'll get some of the first data about really the efficacy of the system. And then, I mentioned this is really a partnership with Mental Health America. So they have some populations that they're really interested in better serving. They have a ton of adolescents who take self-screeners. So this tool we designed with young adults, but we just ran a study with 18-year-olds to understand, this is kind of a near peer approach because of easier access to adults, very young adults, 18-year-olds. But we kind of asked them over the past several years, or when you were in high school, how would you have responded to this tool, to think about some of the adjustments that might be needed, and starting to analyze those data. And then we also have been working on a version of Small Steps that is potentially tailored to the needs of African Americans. So we ran a similar study with about 25 African Americans to get their feedback on the tool and their ideas for how we can refine it and build in some tailored content. So some of the low-hanging fruit for both groups is the user stories, how those can kind of reflect the needs and circumstances of those populations, but also potentially the algorithms. So there's a lot of ways of thinking about adapting to subpopulations. Some of the feedback we've gotten is also multimedia. So everything is text-based right now, but our dialogue system does allow us to send images and GIFs. So that's something I'm very interested in incorporating, potentially another way to keep people a little bit more engaged. And then how can small steps fit into care systems? So one of the use cases we're thinking a lot about are waiting lists. So people who do want mental health treatment maybe, but they have to wait for potentially 6 months. Is this something that could help them in the interim? We do have content within the program about help seeking, helping people prepare for understanding what therapy might be like, potentially leading them to be more open to that relationship. And also, something that I'm very curious about is whether, and I really don't know, but like whether the data from people's interactions with small steps would be helpful in informing the mental health treatment that they ultimately receive, both like the type of treatment or even the specific conversations that they had. And then large language models. So just there's a lot of enthusiasm right now for large language models. Some people trying to build completely new systems that are conversational therapy systems using LLMs. I really think where these can be most helpful is complementing existing evidence-based digital mental health tools. So I'm actually really excited about kind of thinking of large language models more as a way to augment small steps or programs like small steps, because it addresses an existing gap that's pretty clear, which is the impersonality and the repetitiveness of the program, particularly after people input this free text. So it addresses some of the known problems with the program. But I think at the same time, small steps really can provide a helpful structure so that we're not, some of the challenges with LLMs is they're fundamentally unpredictable. We don't know what responses are going to be delivered. So small steps provides a structure. It's an ongoing relationship where these models can be used. It helps establish predictability and helps us manage risks. So just as one example, this is kind of a typical dialogue that someone might have with the program. This is content about willingness. So we ask them this open-ended reflection question. What's a new experience that you're interested in, but that you've held back from pursuing? So this person enters several sentences, they're really thinking about the question, they're deeply engaging, and then small steps just says, thank you for sharing, and moves on to the next thing. So there's a couple ways that LLMs can be helpful here. The first is that if we wanted to generate many, many more dialogues, even in an offline way, I think these models can be really helpful for content generation. But I think much more exciting is the potential for live personalized responses. So an alternative version of small steps instead of thank you for sharing, and this is a real ChatGPT generated response, and we've experimented with typical user responses and seen what ChatGPT spits out. And in general, if you give the right kind of guidance, I think they're pretty good. So in this case, it says, I can understand why you're feeling anxious about dating. It would be intimidating, we had to kind of think about prompt engineering issues. How do we present the small steps program? We ended up using, this is a mental health coach, that sort of language. And we also had to tell it, like, don't ask a follow-up question, because the responses we get from the LLMs are really question-oriented, but we don't necessarily want to go down that road here. We were more looking at a personalized kind of one-off response to these free text messages. So this is just an example of how you could integrate LLMs. I'm starting to work with end users to understand how they think about this use case and get some other ideas for how they think this technology could be integrated. So looking toward refining and testing this in the near term. This is another approach. This is actually a project that I just submitted a grant to NIMH, a proposal in October. And this kind of gets at this other issue of how can we use mobile sensors to gather some relevant information about where people are, what they're going through, in order to make the messaging, automated messaging, more personally relevant. And this is a project where we would potentially use GPS data, which are one of the sensor features most correlated with mental health. And so the idea here is, if we know where people are, can we send them personalized messaging? And here it's really around getting people to go more places and spend more time outside of the home. So this is based on behavioral activation. So, and then with Heather, as she mentioned, a grant where we just put in together that she's leading. And so that's another kind of direction where we're looking at using messaging with multiple parties. So that's another direction I think could be really, really helpful. So that's an example where we're looking at bringing in both the parent and the adolescent. So just some of the directions I think are really exciting with automated messaging approaches, and all of them quite scalable. So that is what I have. But yeah, thank you so much for your attention, and I'm looking forward to chatting.
Thank you so much, Rachel, for sharing all this. Such cool work. I kind of knew some of what you're working on, but not in that much detail. And it's really nice to see how it all came together and all the work that you did along the way to make sure that the technology was responsive, to the needs of the populations that you're working with. And what power, Mental Health America have to bring so much, so many people in, even in the early stages, getting 5,000 people, for pilot data is like pretty incredible.